Greetings. Today I want to talk to you about pediatric preventative care. What I mean by that is when you have your child's eyes examined, would you like to prevent problems or just treat them? Well, obviously we all want to prevent problems. And this is something that optometry does uniquely because we test vision for eye coordination problems, which can predict developmental problems as children go on. For example, convergence insufficiency, which means the eyes don't turn in together effectively. Child may read 20/20, but not be able to do well in school or not achieve at the level they should achieve. They may be identified as ADD or dyslexic or having reading problems, perceptual problems. The people that diagnose this are optometrists, and not all optometrists. There are optometrists like us, and there are a few others in the county and nearby counties that do this. But you can't get this care in some of the large groups, for example, where there are only medical doctors who are very good eye doctors when it comes to certain things, but not preventive care. So if you have a child and you want to be sure that they're getting the best preventative care, they need to be seen by an optometrist particularly who does vision training, because there are options. For example, with a convergence problem, there's eye exercises which resolve the problem before they become an issue and the child has difficulty in school. For children whose eyes tend to cross and turn inward, which you wouldn't see because it only happens during reading, which is convergence excess, there are multifocal glasses that can be prescribed for children. And this does two things. It helps them read better, but it also prevents, in many cases, them from getting nearsighted and needing glasses all the time, or at least reduces the nearsightedness that may ensue because of their growth. So when you're thinking preventative care, I want you to start thinking about optometry. And if you're in a large medical group, as many groups are forming in response to Obamacare, you won't find optometrists because we do a very extensive exam that doesn't usually fit into the now volume processing plans that the groups are becoming, because they have to survive, not because your doctor is not a good doctor. So to get the best care for your child, think optometry.